This content is AI generated for informational purposes only and should not be directly used for clinical decision-making.
Hello and welcome back to the Neurosurgery Hub podcast. I'm Dr. Aris, Senior Attending Neurosurgeon.
And I'm Dr. Alara, Research Fellow. Today we're looking at a fascinating new study from the Journal of Investigative Surgery, published in 2026, titled Advances in Ultrasound-Guided Fascial Plane Blocks for Perioperative Acute Pain Management.
This is a timely review, Alara. In neurosurgery, particularly in complex spine cases or even when we're harvesting autologous grafts, perioperative acute pain remains a major challenge. We know all too well that conventional analgesic strategies are often limited by inadequate efficacy and, more importantly, opioid-related adverse effects.
Exactly, Dr. Aris. The paper highlights that ultrasound-guided fascial plane blocks, or FPBs, have become important components of multimodal analgesia. For our residents listening, the fundamental mechanism involves the injection of local anesthetic into the potential space between two layers of fascia.
Right. And because those fascial planes contain the nerves we're targeting, the anesthetic can spread across a wide area. The review specifically looks at three major blocks: the transversus abdominis plane, or TAP block, the quadratus lumborum, and the serratus anterior plane blocks.
While these are often associated with abdominal or thoracic surgery, the paper emphasizes their clinical efficacy and safety across the surgical spectrum. For a neurosurgical team, understanding the quadratus lumborum block, for example, is increasingly relevant as we move toward more comprehensive ERAS protocols, enhanced recovery after surgery.
Let's dive deeper into the efficacy. The paper summarizes that these FPBs offer a significant reduction in opioid consumption. In the context of a 2026 neurosurgical practice where we are trying to get patients mobilized faster and avoid the respiratory depression or ileus associated with heavy narcotics, that's a game changer.
It really is. The authors point out that the ultrasound-guided nature of these blocks is what has elevated their safety profile. By using real-time imaging, we can ensure the needle tip is exactly in that fascial plane, reducing the risk of vascular puncture or nerve injury.
But the paper doesn't just stop at the current state of the art. It looks into future directions. Dr. Alara, what do the authors have to say about the integration of technology, specifically artificial intelligence?
That was one of the most interesting parts of the review. The paper discusses the emerging role of AI in ultrasound-guided blocks. AI is being developed to assist with real-time image recognition. It can help the clinician identify those subtle fascial layers and even predict the spread of the local anesthetic based on the patient's specific anatomy.
That's a significant leap for medical education. For a neurosurgery resident who might not perform these blocks as frequently as an anesthesiologist, having AI-augmented ultrasound could drastically flatten the learning curve.
Precisely. The study suggests that AI can reduce the time it takes to perform the block and increase the success rate by providing automated guidance. It's about precision medicine, ensuring the fascial plane isn't just a theoretical target, but a confirmed one.
To summarize for our listeners, the paper concludes that as perioperative acute pain remains a major challenge, FPBs like the TAP, QL, and serratus anterior plane blocks are essential for multimodal analgesia. They offer a path away from opioid-related adverse effects.
And with the future integration of AI, these tools are going to become even more accessible and safer for the entire perioperative team.
It's a great reminder that being a neurosurgeon in 2026 means looking beyond the dura and the lamina. We have to be leaders in every aspect of our patient's recovery.
Well said, Dr. Aris. We hope this review provides some valuable insights for your next grand rounds or clinical rotation.
Thanks for joining us on the Neurosurgery Hub podcast. We'll see you next time.